I'm curious, who does the treatment planning? And is that something that you, as the LPN, are able to do and then execute it? Or is that something that your medical provider, well, not medical provider, but your provider has to
Yeah.
treatment plan and then you're able to do the treatment plan?
So basically what happens, it's very similar what happens in the hygiene room, right? Where I think a lot of hygienists, what they do is they kind of set the doctor up and say, these are, I think, what the recommendations that the doctor is going to say, like, or you need a crown on, it looks like you have something going on number 14. It could possibly be a filling. It could possibly be a crown. We kind of set that up for the patient.
Mhm.
And then we bring the doctor in and the doctor usually confirms what we said, right? And approves it. And that's what happens really in our practice for the aesthetic side is that we address their issues, see what their end goal is. We tell them what the treatment options are, the dosing that it's going to be, and then the doctor will look it over and give it a thumbs up and say, yes, I agree with that, or no, let's add something here, or let's change this, or why don't we start at this area first. Um, but typically it's we set it up, we give our recommendation, and then we get approval from the doctor, and then we perform the treatment. So it's kind of it's a very, very simple flow. It's just like a hygiene exam.
Yeah, no, which just makes sense why hygienists should be able to do this if it just integrates
Yes.
so beautifully.